Good afternoon. Today is Wednesday, May 20th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me today is Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department and the Central New York region. Oswego County and the Central New York region are among the first in the state that were allowed to start reopening. We want to make sure we continue to be among the first. I want to take some time today to review the criteria for the Phase 1 reopening, especially what that means for businesses. It doesn't mean that you can just hang a sign on the door, open your doors to customers, employees, and hand out masks to those who don't have them. Businesses must develop a reopening safety plan, certify to the state that they have met that obligation, share it with their employees, and have it available at their place of businesses for the public and any regulatory officials who may wish to view it. This is a detailed plan that spells out the steps that business owners will take to keep their employees and customers safe. A business needs to make sure there's proper spacing among customers and employees, there's proper sanitation, and have a procedure for responding to coronavirus in their place of business, among other requirements. It is critical that businesses follow the procedures required by New York State if they desire to reopen and remain open. The state has tracking who has and who hasn't filed their plans. We do not want Oswego County to be the ones holding up the region in compliance. There's guidance on how to do this on the OswegoCounty.com Restart webpage at OswegoCounty.com. This is a directory of online resources created by the county to help businesses and organizations prepare for reopening. It is updated daily, and I encourage you to use it. The members of the Central New York Regional Control Room meet every day. I assure you we are working aggressively to get answers on every issue that has been brought to our attention. Things are evolving quickly, and we expect this will continue for some time to come. I will continue to keep you informed of the reopening process. I would also like to share with you some important information as we head into the Memorial Day weekend. The governor gave permission for public beaches to open at half capacity, but not all of them are ready. Here in Oswego County, we don't expect Selkirk Shores or Sandy Island Beach to be open for swimming until July. The water's a little cold for swimming in the lake this weekend anyways. And our county health department reminds us that public gatherings are one of the easiest way to spread the coronavirus and should be avoided. The virus is easily spread through physical contact sports such as basketball and volleyball. These activities should also be avoided. Social distancing and wearing masks in public when social distancing can't be maintained is still required. Whether we like it or not, we presently live in a COVID-19 environment. Community transmission is still occurring. Each one of us shares the responsibility to help protect each other. Staying safe from infection must be our highest priority. Please continue to wash hands frequently, wear a face mask, and maintain social distancing. These steps will help us maintain the metrics we need to continue reopening Oswego County and the Central New York region. Diane?
Thank you, Mr. Chairman. Many residents continue to have questions about testing. Currently, PCR testing and antibody testing is available in Oswego County. PCR testing, or diagnostic testing, tests for the virus. Antibody testing looks for the body's immune response from exposure to the virus. It is not a test for the actual virus. Testing availability in Oswego County is changing frequently based on new providers offering tests, availability of testing supplies, and lab capacities. Several locations around Oswego County are currently open for testing. WellNow Urgent Care at 200 East 1st Street in Oswego is conducting PCR tests and antibody testing for symptomatic people and asymptomatic essential workers from 8 a.m. to 8 p.m. daily. The Oswego Hospital conducts PCR testing for symptomatic people from 9 to 1, Monday through Saturday. People are asked to call 315-349-3330 for an appointment at that location. Pulaski Urgent Care conducts PCR and antibody testing for both symptomatic and non-symptomatic people from 8 a.m. to 4 p.m. daily. People must be seen by a staff healthcare provider, and they are strongly encouraged to call ahead of time at 298-2273 before they arrive for testing. Connect Care clinics are currently conducting PCR testing for their patients only. Patients are asked to call their regular health care provider for more information. Essential workers who don't have symptoms of COVID-19 may also visit a New York State testing site. The closest state testing sites are Griffith International Airport in Rome, Binghamton University in Binghamton, and Monroe County Community College in Rochester. To make an appointment at one of these state testing sites, call the state COVID-19 hotline at 1-888-364-3065 or visit covid19screening.health.ny.gov/. There's an online screening test to determine who meets the state's criteria for coronavirus testing. Recently, New York State has announced 2 initiatives aimed at protecting our vulnerable residents in nursing homes and adult care facilities. These initiatives include mandated testing for all nursing home staff and adult care facility staff twice a week. In addition, New York State is requesting that all residents in nursing homes be tested. Oswego County is partnering with Oswego Health, our skilled nursing facilities and adult care facilities, and New York State Department of Health to implement these initiatives. The New York State Health Department will be coming to the county to test nursing home residents starting this week. We encourage all residents to contact their primary care providers to discuss testing issues or call the Oswego County COVID-19 hotline at 315-349-3330. Today's testing numbers, the number of residents that have been tested or are scheduled to be tested is 3,552. We've had a total of 87 residents test positive for COVID-19, and we have 69 residents that are recovering. We've had 3 deaths in the county related to COVID-19, and we currently have 15 active cases of COVID-19. Total negative reports that we've received is 3,206. That's negative test results, and we have 87 residents currently under mandatory isolation or quarantine. Thanks.
Thank you, Diane. Again, I want to thank the County Health Department team, Oswego Health, and all of our frontline workers and first responders for everything you do to keep our residents safe and healthy. Our goal continues to be providing the safest possible environment for our families and neighbors, our customers, and our visitors when they start to return. Please keep referring to the Reopen Oswego County page and the COVID-19 page on the county website for an online resource and credible, up-to-date information. Stay safe, and thank you for your continued patience and cooperation. We are all in this together, and together we will come through it successfully.